So do tools like Graston actually help to improve your performance? Well, let's find out. So before we start to get into how to perform IASTM or instrument assisted soft tissue massage, it's important to understand what its original purpose was and the effects it's proposed to have. So IASTM is a tool that is supposed to help to mobilize the skin, fascia, and scars to create changes to improve your flexibility, your pain tolerance, and the process of healing. So the first proposed effect of IASTM is that it provides controlled microtrauma to the tissues in order to elicit a local inflammatory response. And what this does is help to reabsorb any scar tissues or unwanted fibrosis and to allow for a healing cascade to remodel the affected tissues. Of course, there is research stating that there is no proof of this and that the forces are way too low to have any effect on the tissues. So I'll leave the research articles right over here just in case you want to read a little bit more into it and get a better understanding of why it cannot affect those structures. Now, the second proposed effect is its neurophysiologic impact on mechanosensitive receptors. And what this does is help to reduce pain. Now, IASM is applied to create deformation of the skin to stimulate those mechanosensitive receptors such as two-point discrimination and nociceptors, which are responsible for our pain perception. Now, luckily, this is one proposed effect that does have a positive impact on outcomes. Research has shown that these tools do have a short-term benefit to improving pain. However, it doesn't have any more of a benefit compared to massage or any other form of modality to address pain. Now, I'll leave those articles right here once again, just in case you want to read a little more into it. Number 3 is its vascular effects on the body. Now, it's proposed that it helps to increase perfusion, which in turn provides nutrients and all the immune system factors to help with healing. And it's also believed that you have to have bruising in order to have the effects of IASTM. Now, research has shown that there is no benefit to bruising compared to just general redness around the skin, so you do not need to apply pressure to the point that you are bruising the area. Now that you know everything about instrument-assisted soft tissue massage, let's get into how the application of it works. So starting off, let's talk about the tools. Now, you can find a variety of tools from Gua Sha to Graston or other off-brand tools that are made of various amounts of materials such as metal to crystals and plastic and acrylics. Now, none of this actually matters when it comes to the outcomes and the treatment effects of instrument-assisted soft tissue massage. What's important is that you find something that feels best for you. Personally, I like to use a variety of materials because I am working with a bunch of people backstage and I want to make sure that the performers are comfortable with whatever I use. Another thing to think about are the prices of these tools. You can always purchase name brand items such as Graston, which can go for a couple hundred to $1,000. Or you can go for cheaper alternatives such as Gua Sha, which only costs usually $10 to $20. Or you can just find something for free. You can even use a dull side of a butter knife or a steak knife or whatever you have to apply the techniques because it's gonna have the same effects. Now, if you don't feel comfortable using a knife on your leg, then you can go ahead and buy and purchase something else. The next thing to think about is how do you apply the forces and which directions and how long, and all these depend on you. So whether or not you stroke in more of a parallel direction along the muscles or tendons, or if you go across and rub fast or rub slow, it really doesn't matter. Again, it has the same effect. And typically what I will say is that you want to apply the technique long enough to create what looks like perfusion by creating redness along the skin. Now, it's also important to recognize that we don't all have the same skin tone. So if you do have a bit of a darker skin tone, you won't see as much reddening, and that is okay. What you want to look out for is whether or not the area feels any less sensitive than it did when you started. That is a good stopping point. You do not want to keep going until you bruise. You do not want to keep going until you break through the skin, because that is counterintuitive. So let's go ahead and grab a tool. And what you're going to do is you're going to hold that tool nice and firm, and you are going to glide that tool across the skin in any direction that you want. And you're going to repeat this over and over again. It's that simple. And once you start to see some red, that is when you can start to decide if you want to stop, and you can go ahead and find any other areas that feel sore, or you feel like there are restrictions or tightness or tenderness, and you can apply that same technique there. You just want to make sure that you do not apply it over any hard surfaces such as your bones. Now, the best way to identify whether or not you are going over muscle and tendon versus bone is by looking at where you are. Chances are, if you're going around a joint, it is going to be more bony. And you can find the muscle because it usually is in between two joints. And the tendon is at the ends by the joints. So take it with a grain of salt. Whether or not you do it across a specific structure or generally over the area where you're sore, it's again gonna have the same effects. I'm sure you're tired of hearing that, but that is the truth. So if you have any questions about instrument assisted soft tissue massage, go ahead and send me a message and I will do my best to leave a response, or you can leave a comment below. I hope that this video was informational, and look out for more in the future. Until next time, peace.